you obviously know he treated me for my lower back and my disc issue. Still having a little bit of discomfort, early morning pain, and I don't know, just not 100% yet. I'm 100% in jiu-jitsu, but I can't run, surprisingly. So the jumping and the twisting, I could feel it across the lower back.
Okay.
Those symptoms. Still doing my rehab to some extent, guys. Some extent.
Always.
Not entirely, but still doing a lot of posterior chain strengthening. However, the last 2 weeks, I have fallen off because I've increased my jiu-jitsu significantly, but decreased my weight training and my rehab. So don't make that same mistake. I know I'm doing it, but looking for a little bit of like, I'm at like 90, 92%. How do I get it to that? Like, how do I get that last 3, 4, 5, 6, 7% back?
Yeah, let's go ahead. I want to check through because as you mentioned, like a lot of the stuff where bracing going through more sagittal plane, like front to back movements of hinging are probably okay for you. It's more, as you mentioned, more those dynamic movements of like twisting or bending that are probably going to be a little more irritating. So I want to check that out.
One thing I did start this week, and it seemed to be somewhat worse on one side, was this side, was the pull-off press. I do a pull-off press, walk away, and not actually rotate. And I felt this side on the right significantly harder than the left. So, and I felt more strain back there.
Okay.
And a lot more of my hips working. So I just got to fill you in on that.
So let's do this. I want you to start on your back face up for me. I'm going to check just hips out, see how those are moving. So let's check some stuff out here. Go ahead and straighten that leg out for me. Let's go through, just kind of screen the hips and see where we're at. If you're getting any compression, tightness, pinching in the front of the hip, or is that all just stretch in the back?
All right, do it again.
Yeah.
60-40.
Okay.
I do have a labral tear on this side.
Ah, okay.
Surprisingly, this side has been rehabbed extremely well to the point where it's got more mobility, but there's some issues though.
Okay, so let's compare here. Any compression in the front or just stretch in the back?
Nah, either. A little bit there.
Okay. Now let's go through. I want to just check into some external rotation.
A little bit there. A little bit there.
Okay. Now relax that. Let's go into a little bit of internal here. Relax that leg for me. Cramp. Oh, that is way tighter. That's crazy.
Yeah, except that feels like less vulnerable.
Okay.
Surprisingly.
And then what about internal?
No problem at all.
Interesting
Bloopers,
though, because
dude. Yeah,
here,
I feel that.
definitely any pinch in the front, any grinding.
Surprisingly, pretty darn good.
Okay.
Usually, I have my moments.
Yeah. Now, just go straight leg raise. So right leg, just go ahead and lift. Slowly lower back down. Any pulling, tugging in the lower back with that?
No.
Okay, go ahead, do the left leg. Slowly lower back down. And not too bad through there, right?
Beautiful.
Okay. Now, I want you to come up into a dead bug style position. So come up to 90-90. Good. Julie, you can probably come around the side here. And let's just go both arms straight up to the ceiling, hands together. Good. And just holding, bracing right through there. Okay. And just go ahead and start to push.
I feel pinching on the right hip.
Right hip. Front of the right hip.
Yep.
Okay. And now push.
Nothing.
Nothing. Okay. Go ahead and relax that
makes
for
sense.
me.
All right.
Oh, no, that was it. That was, so again, just trying to test a little bit more of that oblique work of how core tying in with the front of the hip, but I think it's also playing a role into what's going on in the lower back when you said you're having some running issues. So I want to check that a little bit more. Go on your stomach.
Yeah, I have not ran at all. Not even tried.
Just take the mic out so that's off, and you can always just, I'll usually like clip it or magnet it to that.
Oh, that's right. I forgot it's magnet.
Yeah, it's nice.
Oh,
there you go.
It's great.
Good.
I've never done that before.
Oh, I clip it to the table all the time. Any pinch or just stretching the thigh?
Feels good.
Nothing in the lower back?
0.
Okay. And then same exact thing. Ooh, a little tighter on that side.
A little bit.
A little bit. Okay. Okay, go ahead, relax that. Let that drop. Okay, so just
feel a little bit in the lower back.
Okay.
On that right.
Yeah. Right here.
Surprisingly not.
Okay. Through here.
That's a little bit on the left side too.
A little bit on the left side as well.
It went away more the second time.
Okay, let's try it again.
Went away.
Okay.
Feels like pressure. No.
Nothing through there. Okay. Now, without bending the knee, right leg lift up in the air. Come back down. Do it one more time, straight leg though. Don't bend the knee. Go. And come on back down. Any pinching in the lower back or just squeezing the glute and hamstring? Okay.
Yeah.
Do this leg. Lift.
This side feels harder.
Harder to lift.
Surprisingly.
Okay. All right. So, any tension? Right.
A little bit right.
Left side.
Left.
I would say right, left, even.
That seems center.
Centered. Okay.
That's normal. No tension.
Okay.
No tension.
No noticeable difference.
The
Now,
lower you were, the more tension there was.
okay. So let me check across the hip crest here. Let me know. Right, left, even.
It was like very light on the right.
Okay. Okay. Anything here?
Okay.
Okay. All right. So let's dig in through here. I'm going to just open up this glute a little bit. Minus the pressure in the glute, let me know if it works into the lower back, okay? Anything there?
Nothing. No nerve pain, no sciatica, but still some of that
Tension.
morning discopathy, lower back aches in the morning at times.
Okay.
Significantly better, and I can tell you, and you know this, and maybe the patients watching this don't know this, that sit to stand, stand to sit, getting up in the morning has been significantly easier. Maybe I should know.
I swear to God, if you rip right now, I will drop my elbow into your L5. I will Randy Orton you through this table.
I'm not, but definitely not eating before I see you again. I'll tell you that. I'm going on a fasted stomach.
Let's go right through here.
That's where I feel it.
Yeah. So that's where.
That's exactly the pain.
Okay. So putting pressure into the base of the rib cage as we start to take the lumbar spine through some rotation, that's where you get lit up in that lower right. Okay. Away. So let's come around other side. No, you're good where you are. I'm just directing Julia here. So now always compare right to left, right? As we come in through here and as I lift up.
Surprisingly, I feel it there, but it's more centered.
More centered.
The other one is more like there.
Pure right
this
side.
One is more like there-ish.
Yep.
So slight irritation on both sides.
Okay.
But not as bad.
But my goal is if we're not getting rotation out of that TL junction, then you're starting to get that jamming at your lumbar spine. So that's where I'm going to dig into is I'm going to loosen this up through backside of the rib cage, and I'm going to work in a little bit of that rotation. Right through there. Breathe. Let it settle. Let it settle. Good. There you go. Okay. Let me get into this now.
I feel like I'm still buzzing.
Right through there.
Feels already less tender.
Yeah. Well, that's the beautiful thing. I mean, I don't know about you. I just tend to use the hypervolt to kind of loosen up like the surface level tissue. And then that allows me to kind of use my hands to get into like some of those deeper layers. All right, and through there. Breathe. Good. Good. There. Take deep breaths into my hands here. Nice. Again. And drop. Okay. I'm going to adjust a little bit above this area.
Oh, that was it.
Already went. Beautiful. Put this right here. Oh, magnet went with it. Got it. Don't worry. Nope. Nada. One more. There we go. Little baby pops though. Oh, good. Let's see. Turn your head all the way to the right and then all the way to the left. There, and then other side. Easier to turn one side versus the other.
To the right. This side sucks.
This side sucks. On over here on the right.
Left.
Left. Up high though?
Yeah.
Okay. Come back down. Good. Stay where you are. Don't worry. Okay. No pinch, right? Good. Relax your left shoulder. There we go. Smooth sailing. Come on back. Here. Yep. You okay on the left side there? There we go. Right. Now, first, go on your back, face up.
Kyro's trying to fix the damn chairs.
What?
I try to fix the chair.
Fix what chair?
You know, just like.
Oh, lift it up? Yeah, I know. Old habits. Old habits. There. Head up for a second. Oh, hold on. I know what happens when I do this. Head up for a second. Good, I got you. Now I'm going to get deep into that TL junction, so I'm going to lift you way up. Don't help me, okay? Exhale. Good. Drop. Let it fall. Let her go. All the way out. You okay? Good. One more. I'm going to go low into this guy here. Let it go. There we go. Yeah, one more. Tuck your chin. Look down. There we go. Good. All right. Now, I want to get this right side. So face that way on your side. Good. Let me just see here. Oh, my apologies. Hold on. Let that just. I'm going to go up a little bit higher, okay? Let that drop here. Yep. There. A little bit more lower. Open up a little bit. Yep. Nice. There we go. Now let's come back, reassess. Drop. Okay. Relax that. Let me know when. Okay. Here, hold on. Outside of just stretching the hip, anything in the lower back. Last one. Relax that. Nothing. Great. Now, really quick, come back up to that dead bug position. 90-90. Yep. A little more. A little more. Knee up. Yep, there. Hands together. Good. Ready? Start to push.
Just weaker.
But not as much. No pinching in the front of the hip anymore. And then this side wasn't a problem before, but nothing.
No pinching.
Okay.
Just weaker.
Good. Go back on your stomach. Okay. Let's go into here. Say push.
Probably like
How much better?
50-60% better.
Okay. Good.
Maybe more like 65.
Okay. Bend as I come across here.
Nothing.
Okay.
It's just more the aggressive rotation of this.
Yes, but not that pinching in the lower back.
Yeah.
And let me just try other side really quick. So same exact thing. I think on this side you said it was more center, more midline, correct?
Yep.
Okay.
Still, that side's a little bit the same.
Okay.
Now it goes away, that one.
Okay.
A lot more.
I'm gonna try it more.
And back a little bit more.
Okay. Now, so last one, I want this side up. There we go. Okay. Yep. Hold on, let her go. There. On your back face up. Good. Now, stay there. Move this leg a little pull, okay? Relax that. Scoot the hips over just a touch towards me. What?
Big table.
It is.
Big table.
I know. I have some big boys, so I need a big table. Nice. Give the labrum some love, huh? It's a labrum of love.
Funny joke.
That's what I'm known for.
Wow. Well, should become bad then. They only get one corner.
Let me feel. There we go. It feels okay. Okay. Switch ankles for me. Just see. This ankle feels better. Yeah, not bad. Did I get that up? Yeah.
You got ankle.
All right. Cool.
Thank you.
Of course, man. Absolutely. Oh, do you want a traction pull on your neck? Feels great. My favorite one.
Just go for the video.
Yeah. Scoot down that way for me. A good amount. Yeah, perfect. Good. As I stretch, I want you to let me know when you feel it working its way down into the mid back, not so much just in the neck, okay? Feel that working its way down?
Starting.
Okay. Take a few deep breaths. Shouldn't be painful at all. Should just be nice and relaxing, like a deep stretch.
Mm-hmm.
Good. A few more deep breaths. All the way out. Hang out there.
I'm not moving for.
What?
I'm not moving for anything.
No. Good. Relax. Let that settle.
Wow.
It's the cherry on the sundae. Good.
I just like the whole Sunday, not the cherry.